The most common symptoms that patients with MDS deal with is fatigue, and that's primarily due to anemia. And anemia is a low red cell count. And red cells are what delivers oxygen through the other parts of our body. So you could essentially think of your red cells as energy carrying cells. So they carry energy to the other cells that we have in our body. And because the red cells can be low in MDS, they don't actually distribute oxygen as well. Another interesting aspect of MDS is that it's not only low blood counts, it's also that the blood cells themselves don't work as well. So even in patients whose blood counts may not be that low, they can still have a lot of symptoms from their disease because the red cells actually don't function as well. And that's one of the reasons why we as physicians don't set an individual number at which all patients should be transfused for red cells, for instance, because many patients can have symptoms at higher numbers of red cells because their red cells may not function in as good a manner. There's also an impact between what we call comorbidities and MDS. So patients who have underlying cardiovascular disease or patients who have lung disease may have more aggressive symptoms with higher red cell counts than patients who are otherwise healthy. So when you're the treating physician, you have to take the overall health of the patient into account in deciding what type of interventions they should receive. But if you're thinking about the major burdens of patients and what they experience, by far the most common complaints that I get are related to fatigue, low energy levels. Additionally, there are some patients who have problems with infections because their neutrophil counts are low. And then there's other patients who have problems with bleeding or bruising because their platelet counts are low. One of the unfortunate aspects about MDS is that the median age of diagnosis is 72. And many patients, when they are diagnosed with this disease, are in their retirement. Maybe they're planning vacations or time to spend with their grandchildren and other loved ones. So having this diagnosis has a significant impact on their plans. And, unfortunately, it tends to occur when people are getting ready to retire. And many patients have transitioned out of their healthcare coverage that they would have through their employer. And so they're generally under Medicare or Medicaid. And that can sometimes be a challenge for physicians and patients to overcome in regards to what can be covered and what is not covered. So that's an issue when it comes to potential curative therapy like allogeneic transplant. But it's also an issue, frankly, in what patients may be able to tolerate, because there is a clear association between increasing age and comorbidities. So for some patients, they're not able or not candidates for a curative procedure. So it's not only the fact that the disease has such an impact on their health, it's also a fact that it affects people who are, in some respects, unhealthier, just to the fact that they are of general older age. I do want to emphasize that not all patients are the same, and there are some patients who are of an older age who do not have comorbidities and who are incredibly healthy, who should be considered for curative types of procedures like stem cell transplant.